Dr. Howard Rollins. I'm at HIMSS 2012 in Las Vegas, and I have the pleasure today of speaking to Mr. Dan Matlow, who is the CEO of Medworxx. Medworxx is a Canadian company, I understand.
That's right.
And you're considered experts in the field of patient flow using utilization management principles. Is that right?
That's correct, Howard. You know, Canada is unique in terms of leading the world in universal health care. And as a result of our healthcare system, our hospitals run their vacancy levels at a 97, 98% occupancy. So the government has focused on projects that were led out through the evolution of a product which we call our Medworxx Utilization Management Patient Flow Solution, which is designed to give hospitals analytics on patients and in terms of their patient flow process and are they appropriate of being in a hospital setting.
Can you tell me a little about specifically how it would work?
Yeah, we do. We've developed this really smart, simple 30-second to 3-minute assessment module using clever, what we call clinical criteria sets, which were developed by a medical group with physicians and doctors over a lengthy period of time, where we do a very solid assessment on the patient every day to understand should they be in an acute care setting, and if they should be and they still are, or they shouldn't be and they still are, what are the reasons, what are the delays, so that we can move the plan forward so that we can move that patient effectively and safely from the hospital and downstream to another setting, therefore reducing costs and freeing up beds, so we're freeing up our wait times in the emergency room. It's a huge issue in our Canadian hospitals.
So the data that you're obtaining is coming directly from the caretaker?
That's right. The frontline caretaker, we call it patient flow navigators, or the frontline nurse, does the assessments every day on the patient, and the data that we get is hugely valuable. It changes the culture of the hospital. They refer to our data every day in their operational reports, and as a result, the culture changes and we see flow and we see movement a lot more effectively through the hospital.
As an aside, I'm just curious, how do you handle the security issues of all this data? Is it an issue?
No, it's a secure product. It's internally installed within the hospitals. We run our system on over 30% of all the beds in Canada. We have provincial deals, regional deals, hospital deals, big specific deals. It's all proven. The data is extremely effective, and now we're excited to bring this into the U.S. marketplace because with all the changes that's going on down in the U.S. systems in terms of efficiencies, we want to share how we develop the system and help the American system get some efficiencies as well.
How do you see the demographics changing in the U.S. hospital system based on what's happening with healthcare here?
In the U.S. systems, fee-for-service isn't going to be the way to go 100%. Hospitals are going to be accountable for efficiencies. The senior level people are going to be accountable for efficiencies. Flow is the big issue. The average cost in our Canadian hospitals is $600 per day for every patient every day. So length of stays is a huge issue. That's one of the easiest ways to improve efficiencies, and flow is a big issue. So we want to help out there.
And your experience in Canada, how has it been? Tell us a little about the results and what you add in value to the facility.
Our hospitals are seeing amazing results in terms of reducing their length of stays on average throughout there. They're focused on their hospital reasons. What are the reasons that a patient is in a hospital? What are the reasons? What are the delays? All those reasons have been reduced. Those are all analytics that come out of our system. As a result, that's how we got provincial deals and big regional deals that have happened, because we're seeing the results and we're seeing the length of stay reductions across some hospitals.
So finally, if I am running a facility here in the U.S. and I hear about Medworxx and I give you a call and I say, tell me how you're going to help me briefly, what do I hear from you?
We're going to go understand your flow issues. We have the ability to go in and do a diagnostic audit either by ourselves or with a partner. We work with a lot of the bigger consulting groups that come in, where we go in and do a benchmark assessment, do a 7-day view of your entire hospital bed and see what patients should, according to our system, be in that hospital setting. And if they were, what were the reasons, what were the delays, so that you can start making process changes within your hospital so that you can effectively make some changes that are really helpful.
Well, Dan, I wish you the best of luck.
Thank you very much, Howard.
In the USA.
Great.
It's been a pleasure talking
Pleasure.
to you.
All the best. Thank you for having me.
This has been Dr. Howard Rollins with EHR TV. I've had the pleasure of speaking with Dan Matlow, CEO of Medworxx.